Hi, I'm Dr. Rebecca Reese. I'm a physician and infectious disease expert in West Virginia. Throughout the pandemic, I have cared for many patients with COVID 19 and have led research on COVID 19. We are hearing a lot about COVID 19 variants, and naturally, there are questions about what they are and if the vaccines are effective at protecting against them. Viruses constantly change through mutation, creating new variants or strains over time. Sometimes new variants emerge and disappear, other times, new variants emerge and stay. Multiple variants of the virus that causes COVID 19 have been found in the United States and around the world during this pandemic. These variants are slightly different from the past strains, and they can even infect people who had COVID 19 before. Scientists continue to study these variants. For example, they are looking to see how easily they spread, the severity of the disease they cause, and how well the vaccines work against them. Ongoing studies have found that the COVID 19 vaccines can help prevent severe disease, hospitalization, and death from the variants. Areas with low vaccination rates are more vulnerable to the virus transforming, potentially becoming more contagious and severe. Large portions of our communities getting vaccinated helps create a firewall against the virus, preventing the virus from spreading and changing. The faster we get vaccinated, the faster we can build a community of immunity against the virus and its variants. Protecting our community from variants is one of the reasons that I chose to get the COVID 19 vaccine and why I recommend it to others. Thanks for tuning in. I'm Dr. Rebecca Reese. For more information about COVID 19 vaccines or to find a location near you, visit vaccinate.wv.gov.
Hi, I am Dr. Marina Galvez Peralta. I am a pharmacist and a pharmaceutical scientist in West Virginia. I graduated from my PharmD in 1999 and my PhD in 2004. I have been in diabetes since 2015. Sometimes people ask me how COVID-19 vaccines have been developed so quickly. The COVID-19 vaccine development process has been the most efficient we have seen to date because the entire medical, scientific, and public health communities mobilized like never before to end this pandemic. Although COVID-19 was a new coronavirus, vaccine scientists did not need to start from scratch. These scientists built on a body of knowledge from extensive research of other viruses and the technology used to respond to them. Typically, when vaccines are developed, the development steps occur one after the other, from early vaccine creation to testing its safety and efficacy in clinical trials, to producing it on a larger scale, and eventually to getting it to the public. This process normally takes years to decades for a vaccine to make it from the first steps of development to use it in our healthcare facilities. In response to the COVID-19 pandemic, all these steps were taken simultaneously, removing delays that could normally happen when they are carried out one after the other. Steps to ensure safety were rigorously upheld as the COVID-19 vaccines were developed. The clinical trials, which include tens of thousands of people, showed that COVID-19 vaccination caused no serious side effects and was highly effective in preventing severe disease and death from COVID-19. These vaccines have now been given to millions of people in the US and all around the world, and the vaccines continue to undergo the most intensive safety monitoring in the US history. I trust the top minds from around the world that have come together to develop these vaccines and end the pandemic, which is why I chose to get vaccinated against COVID-19. I encourage others to choose to get the vaccine as well. Thanks for tuning in. I am Dr. Marina Galvez Peralta. For more information about COVID-19 vaccines or find a location near you, visit vaccinate.wv.gov.
Let's try it again. Hello, everyone. It's Wednesday, August the 25th. I guess my mic was muted. My mic was muted, but very regretfully, and you can see what's happening. Our health experts have told you. I've told you. You know, I don't know how we can be more explicit, but since my last briefing, we've lost 20 more people. Absolutely, we have got to get vaccinated. We have got to get vaccinated right now, and I'll get into it in just one second. But oh boy, the 3,017th death. Excuse me. Oh gracious, I can't tell you. I really can't begin to tell you how sad I am and how difficult it is if you really love West Virginians and you don't want these people to become a number, to sit here with you and read, really, for all practical purposes, name after name of West Virginians that we've lost. It's just really sad. And I want you to be really respectful to these people and know that you love them, or let them know that you love them, and through your prayers or calling them or whatever it may be. But the 3,017th death in West Virginia is a 42-year-old male from Berkeley County. You know, I think about that. My son just turned 40. It's just terrible. The 3,018th death is a 61-year-old female from Fayette County. The 3,019th death is a 70-year-old male from Marshall County. The 3,020th death is a 75-year-old male from Raleigh County. The 3,021st death is an 87-year-old male from Kanawha County. The 3,022nd death is an 80-year-old male from Cabell County. The 3,023rd death is a 92-year-old female from Upshur County. The 3,024th death is an 85-year-old female from Lincoln County. The 3,025th death is a 69-year-old male from Marion County. The 3,026th death is a 70-year-old female from Marshall County. The 3,027th death is an 89-year-old male from Jackson County. The 3,028th death is an 89-year-old male from Randolph County. The 3,029th death is a 56-year-old female from Nicholas County. The 3,030th death is a 95-year-old female from Upshur County. The 3,031st death is a 66-year-old female from Pocahontas County. In addition to that, we have 5 additional deaths, that were unreported to us, and through all the reconciliation and everything, these death certificates now we have. But the 3,032nd death is a 77-year-old male from Hardy County. The 3,033rd death is a 61-year-old male from Fayette County. The 3,034th death is a 76-year-old male from Kanawha County. The 3,035th death is a 47-year-old female from Kanawha County. And the 3,036th death is a 58-year-old female from Monongalia County. We have now, in the state of West Virginia, we have, since we were last with you 2 days ago, or a day and a half ago, we have now 1,102 new positive cases in West Virginia. Our daily positivity rate is at 9.45. Our cumulative rate continues to rise, is at 5.009. In the state of West Virginia right now, we have 11,725 people that are active cases. We have 511 people in the hospital. This is the first time we've been above 500 people since January of 2021. We have 171 people in the ICU units. You know, we know that the overwhelming majority of the people that are hospitalized in the ICU units, the deaths, they're all unvaccinated. Maybe not all, but surely the overwhelming majority is telling us, you've got to get vaccinated. You know, this disease is a killer beyond belief, but in addition to all of that, it is the most miserable death that you can imagine. Can you imagine being there gasping for breath, and finally passing away? It is absolutely tragic beyond belief. You have got to get vaccinated. I have told you over and over and over, there is nothing in your life that you're doing today that is as important as going and getting yourself vaccinated. And if you're not vaccinated, you're absolutely, you could be in for a really, really tough go. I remind you all the time, if you're 65 and older and you have any symptoms whatsoever, you need to go get tested. The antibodies can save your life. That's all there is to it. As far as our face coverings, right now we're trying with all in us to let our local rule stand. It may very well be soon that I'm not going to be able to do that. But right now I am trying with all in me to keep us together, do the safest thing, listen to all the medical experts, but really and truly, it may very well be that we first start back with the mask in schools and then move forward with that. But at this point in time, I still do not have enough evidence in front of me that the masks are really going to curtail this in a significant enough way to be able to put us back in that situation. On Monday, the FDA granted full approval for Pfizer on their COVID-19 vaccine. The thing that we are trying to do with all in us, and I hope and pray that I thought we would have an answer by today. I hope and pray that we will absolutely have an answer from the Biden administration and have an answer that we can go ahead and start administering booster shots to those that are 60 and older that absolutely are out way beyond, the time period that even the Biden administration set. Now just think about this just a second. The reason that we have so many people that are out farther than other states is one thing and one thing only. We got the shots to the people, didn't we? While everybody else was sitting around on their hands trying to figure out what in the world to do, we got the shots in arms of people to protect them. We were the first to get out in front of everything. And I'm very proud of that because I know without any question we saved a bunch of lives. But by being first and get out in front of it, we need to be administering our booster shots right now. Now, Dr. Marsh and General Hoyer are heading this up, and they're in constant contact with the White House, and we are sitting on pins and needles waiting for them to give us the go-ahead that we can start giving booster shots to our people that are 60 and older, that need those shots, that are out past the time period right now. They need those shots, and they need them right now. I do not know what in the world is going on with the Biden administration from the standpoint of us not giving them not giving us the go-ahead to go. We need to go right now. And so if you're 60 and older and you're out 6 months or you're out, past that, when you had your vaccination and everything, we need you to be ready because we'll be ready. We're ready right now. We're going through all of these tabletop exercises and everything, and basically what that means is to put everything out there to be able to figure out exactly how to get people vaccinated with the booster shots and other things immediately. And the National Guard's working that with all the local pharmacies, with everybody, the healthcare facilities, everybody, and we'll be ready to go. But we've got to get the White House to move. This is the silliest thing in the world. And absolutely, we're going to end up with more and more people die if we don't move. Just again, to recap a little bit about Israel and everything, like I said, in 2 months, they went from 200 cases to 50,000. 58% of the people that were hospitalized, were the Delta variant. After giving the third dose, now imagine this, after giving the third dose, that, they found that immediately they had an 86% reduction in risk of developing the COVID, the breakthroughs on the vaccine. They had a 86% reduction, from absolutely people having adverse conditions and everything and ended up hospitalized. I need to read you just a couple things about West Virginia's stats. West Virginia is seeing a 26% increase in the positive cases of people fully vaccinated over the last 8 weeks. A 21% increase in breakthrough cases requiring hospitalization over the past 8 weeks. We have also seen a 25% increase in deaths of people that were fully vaccinated over the last 8 weeks. The bottom line, the time to act is right now. We did get another 6,100 people vaccinated since Monday. That's just to tell it like it is, that's 6,000 people. 6,100 people got vaccinated. That's 6,000 people. Some of them, we will save their lives by getting them vaccinated. I can't tell you if that's 1, 100, or 1,000, but a bunch of those people are going to absolutely have their lives saved. But the bottom line is just this. We don't need 6,100 people getting doses today. We need 26,100 people getting their vaccination right now, or more. 80% of the West Virginia residents that are over the age of 65 years old now are fully vaccinated, had both their shots. 90.9% have had one shot. 84.4% of the 50 and olders have had one shot. 71.1% of the population, 12 and older, are vaccinated with one shot. It's all good. It's just not good enough. The registration for Do It for Baby Dog vaccination sweepstakes is now up and going, and we'll start giving away all these wonderful prizes and everything. It's custom more toward our younger people to really try to get them out and everything. And we have already signed up 100,000 people. You need to sign up again if you haven't been. If you were registered the first time, you got to sign up again. If you weren't registered and you've been vaccinated, just go on and get and register. It won't take just a second and everything. You may end up winning a big prize, and that would be great. Especially it would be great if you're a young person and I could award you, or this great state award you, a full ride scholarship to any institution that you pick in the state of West Virginia. 4 years. Absolutely without any question, that's the great stuff. When we can absolutely do neat stuff and good stuff for our kids, it's really good with me. Vaccine eligibility, 12 and older. Natural immunity, if you've had COVID, you say, oh, I'm in good shape. I've had it, I don't need to get vaccinated. You're being silly. It's not good enough. You need to be vaccinated. From the standpoint of our young people, we need help from our parents and our grandparents to get them across the finish line. All the COVID information is up there on the website. You can go get tested and everything. All the free testing is available to you. We thank Frith and we thank Walgreens. And now we have 31 outbreaks in our long-term care facilities. We have 7 outbreaks in our church communities in 7 counties. That's Barber, Doddridge, Kanawha, Mason, Putnam, Taylor, and Wayne counties. We have 49 inmates with COVID. We have 42 staff cases. And I encourage you every single moment to give blood. To give blood. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. You know, this is a very important time for all of us here in West Virginia. We've talked a lot in the past about how, because we don't have big airports and big cities, that we tend to see things later than many do. If we look around the world, we've talked about Israel, the United Kingdom. As we look in the United States, we know that the southern part of the country and states like Missouri and others have seen the real impact of the Delta variant of COVID-19 in very stark terms. For instance, in Arkansas and Alabama, they currently have no available ICU beds in their entire states. So as we've looked at other states and anticipated what is coming to West Virginia, we are now starting to see the force of the Delta variant be expressed here in West Virginia. And as the governor said, there's really 2 or 3 really important things, and I won't go through a whole bunch of information as I sometimes do, because I want to be more clear and simple. Number 1 is that there is no time to wait to be vaccinated. We know that fully vaccinated people in the United States and in Israel have a remarkably high protection against getting severe disease from COVID-19, on the order of between 9 and 29 times protection from severe disease. The governor's mentioned that we are starting to see more vaccine breakthroughs, and he gave the, I think, absolute true reason why that's so. We vaccinated our older and most vulnerable population early in the pandemic. And while we are 100% committed and working all the time with our federal agencies, we know that people that are far out will really benefit from a booster vaccine. And so we are committed to trying to bring that to West Virginia as soon as possible. But we know even more that it's the people not vaccinated or who haven't finished their vaccination series. They're the ones that are most commonly going to the hospitals, going to the ICUs and dying. We're also starting to see in West Virginia an increase in the number of deaths. And that will tell you that our most vulnerable people who aren't vaccinated are at incredible risk right now. The Delta variant is much more infectious than any other strain of COVID-19 that we've seen. It's caused real devastation around the world, in our country. So it's not only critically important that people choose full vaccination right now, but also it's really important, and this is not a mandate, but that people really pay attention to also protecting themselves with additional mitigation strategies as they feel would be, relevant for them. And we would heavily endorse people who are also fully vaccinated to consider wearing a face covering, a mask that fits tightly around your face if you go inside or around a lot of other people. Try to avoid those environments right now if you can. Make sure that if you're sick, that you're getting yourself tested, and if other people in your family feel sick, get them tested. We know that ultimately we can only survive this and thrive during this as we have done reasonably well to date by staying together, and the governor's been very clear on that. The only other thing I would say is we're tracking hospitalizations, and we're looking at the rates of hospitalizations. And if we look back to our peak number of hospitalizations, which was in the winter and ended up being over 829, I believe, and we track where we are today, with the number of hospitalizations now well over 500, then we can see we're about 90 days ahead of the rate of time it took us to get to that number back in the highest peak. So our rate of increase of severe disease and hospitalization is going up very rapidly. And we know that, as the governor mentioned in his remarks, that we are seeing younger people now get severely ill as well, mostly unvaccinated. So we would absolutely tell people today, and it's still your choice, but we'll tell people today that there is no time to wait to be vaccinated. COVID is fully here in West Virginia. The Delta variant is fully here in West Virginia. And not to scare people, but people should take extra precaution right now, because we know, looking at other states and looking at the rate of speed of severe illness and hospitalizations, that we very well could become Arkansas and Alabama if we don't take better and more care and take it immediately. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'm going to be succinct and to the point. Part of my responsibility to the governor is to provide strategic advice and guidance and overview to him to be able to address things that he needs to address. So I want to focus back on the hospital piece. So we currently are at 64% of the peak that we saw last time, as Clay pointed out, 829. We are on a path. If we stay on the current path that we are on, we could more than double that number. We know that the preponderance of people in the hospital right now, the number is now up to 521, and actually will go higher today based on updated numbers. We are at 521 in 53 days. So the bottom line message, strategic message to all of West Virginia is currently unvaccinated West Virginians are filling up our hospital capacity and taking away from other West Virginians the ability to get hospital care down the road if we don't get more West Virginians vaccinated. Thank you.
Thank you, sir. Secretary Bill Crouch with the DHHR and Dr. Ayn Amjad, our state health officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, a few days ago, I was asking you about different ways to motivate people to come forward to get a vaccine. And the day that happened, I received a call at our radio station from Coach Kevin Whiteman from Frankfort High School, who was in attendance when his mother passed away from complications from COVID-19. And I would like to play you part of his call to me that he has given permission to forward on to this press conference.
I watched my mother die from it, and she suffered for 2 weeks. She couldn't breathe. She was on oxygen, ended up on a ventilator. Her death certificate says COVID pneumonia, COVID stroke. The day I watched her die, I sat there with my family for 5 hours and watched her die. There were 17 people laying on ventilators on that floor. When I walked through, I was looking in the rooms, and there were people in their 30s and their 40s and their 50s. It was all age groups, and it was a pitiful sight.
Well, that is Coach Whiteman, and I wondered if you had given consideration to having other testimonials like that as part of your campaign to get people vaccinated, because that's an emotional plea for people to take it seriously. Thank you.
Paul, first and foremost, for the coach to do that, that's really good, and it's honorable in every way. I'm sure it's an honor. It's honorable to his mom, but at the same time, it's a testimonial that is absolutely should be heard by all of us. I mean, it takes real guts and real courage to do that, and I thank the coach in every way. And I think, we are constantly bombarded with testimonials, and without any question, I think that has a profound impact Paul, we'll take your advice and we'll go back and we'll look at maybe doing something like this right along with our briefings and in every way, because there was a fella right not far from my home in Lewisburg, and when I'm there, and he was a prominent guy, ran for political office and everything, and he's saying that he didn't take the vaccine, he didn't believe in it and everything else, and now he'd be glad to come on and tell everybody, each and every person alive, that they ought to be taking the vaccine. It was terrible. And so, again, thanks to the coach, thanks to you, Paul. Any and every suggestion we're going to look at, and we're going to try to incorporate. Nobody's got all the answers, but there's no question that that's very impactful. And again, Coach, we'll keep your mom in prayer, you in prayer, and thank you for all you do, coaching kids and doing all the good stuff you do. But thank you for coming on.
Thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping to get a little bit more context on our hospitalization numbers. So we have 511 statewide hospitalized right now. What percentage of total capacity are we at? And what is the ceiling of COVID patients? I know, we were saying we're on track to be at the all-time peak in 90 days, but even at the last peak, I don't think our hospital systems were completely overwhelmed. What is the ceiling? What is the number of patients that the system max out at? Thank you.
General, I think you and Dr. Amjad maybe can handle this better than anybody.
Yes, sir, Governor. So, Charles, it's driven by a couple of factors. In the last surge, we were more focused on bed capacity and equipment capacity, and we never went above 90-some% of the total capacity statewide. But you've got to understand, now we're in a different environment where we have to look at staffing issues with the hospital association and the hospitals every day, because those staffing levels are changing, because quite frankly, other states that are in really dire circumstances are poaching healthcare providers away from other states with much higher pay opportunities, because they're struggling to keep up with the pace. So what we've been looking at with the hospital association and our hospital partners is we look at the overall capacity each day, but this trend line we've been showing is designed to let West Virginia know that we are at a pace that we can't sustain. And I couldn't give you an exact number today to say X number of patients is our absolute breaking point, because each day those numbers are changing related to staffing availability and other things such as equipment, for example, ventilators and other things. So apologize for not being able to be clear, but what I can be clear of is what I said earlier. Unvaccinated West Virginians are taking away access to health care from other West Virginians, and it is at a significant pace right now that the governor and his team are exceptionally concerned about.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. First off, Governor, as a son of Marshall, I'd like to invite you to the Paint the Capital City Green event tomorrow night at Yeager Airport, the Bill No Flight School hangar, 6:30. Coach Huff will be there. A chance to help support the herd. So if you're free, come on out. And real quickly, to talk about your efforts to get the federal approval for booster vaccine doses, we did a quick investigation yesterday and found that West Virginia Health Right on Washington Street and the Kanawha Charleston Health Department, or the Civic Center and Coliseum and Convention Center, are giving out booster doses of the vaccine right now for people who are eligible. So if you're interested in a booster and you're out there, check with your doctor, see if there's a location near you. If you're in the Charleston area, there's a couple locations. Two quick questions. One, is there any interest in exploring the surge capabilities that we have, General Hoyer, as far as ramping St. Francis up, or at least warming the place up just in case, or cooling it down, as the case may be. And when you talk about masks from Dr. Marsh, one of the big problems that I've seen, that people have seen, is that masks are effective if the right mask is worn effectively. And I think where people are kind of jumping the shark or losing the message is they wear a mask that's not covered, they wear a gaiter, they wear something that's really not that effective, especially the paper surgical masks, which lose effectiveness in about 20 or 30 minutes. So can you guys talk about the importance of not just wearing a mask, but wearing the right mask to protect yourself and others? Thanks.
Dr. Marsh and General Hoyer, y'all handle this, please.
Want to go first, Jim?
Yes, sir.
Okay, I'll go first. So, Kenny, you're right. The mask, the fit is important, probably more important the fit on the face, but incredibly important to keep the mask over your nose and your mouth. One way to tell if the mask is sufficient is just to hold it up to light. If you can see light coming through the mask is not going to be effective for you. And if you pull the mask down over your nose or your mouth, that mask isn't going to be effective either. And it's important to recognize that, particularly with this much more infectious Delta variant that can end up in much higher concentrations in the nose, that the real benefit of a good fitting mask, that people wear it, is that it reduces the droplets, it reduces the aerosols that we generate from talking, singing, yelling, coughing, sneezing, which protects the environment for other people. It's about 40 to 60% effective, at least, given some data through the Centers for Disease Control, but only about 20 to 30% effective in blocking those particles from getting through. But because the concentration of the Delta virus is so much higher, any filtering can actually be better, because the inoculum dose, the amount of virus that you get exposed to, and the level of your immune system's threshold to fight that off is really the battle that's being fought. And that's the reason why full vaccination is so important, because you basically increase the threshold. And what we're seeing now in people that have been vaccinated a long time ago, as the governor said, that threshold is reducing. And while in the past, maybe that would have been sufficient, the Delta variant is so much more concentrated that it's overwhelming that threshold. So the booster dose for the people that need it make the threshold go back up again. So you're right, wearing the right mask the right way and wearing it consistently is really important. But also, the more people that wear it in an environment, the better it is for everybody. So Jim, I'll throw the other part back to you.
Yes, thank you, Clay. So Kenny, a couple of things. We have a representative from the Hospital Association that's a key part of our interagency task force. We meet regular with hospital CEOs and medical directors through the Hospital Association. DHHR continues to work to be prepared to open up other spaces, but I go back to the earlier comment. Our primary issue is staffing. Our hospitals are doing a really good job working with each other to balance load across multiple systems. We continue to work that effort, and we'll be prepared with both that and equipment as best we possibly can to address further numbers. Thank you.
All right, thank you, Kenny. Next to Mark Curtis with Nexstar Media.
Good morning, folks. Let me throw out a very unpopular idea, but I think the question needs to be asked, given the numbers and the rate of transmission we're now seeing over the last couple of weeks. We've seen it in New York City, we've seen it in California and other places where people have to show their vaccination card in order to get into restaurants or businesses. You keep talking about the problem of the unvaccinated mingling in with the vaccinated and how that is spreading this and even causing breakthrough cases. Is there any thought or consideration being given to use the vaccination cards as a passport, as they say, for restaurants or other businesses?
Mark, there's no thought right now, but I don't think you can take anything off the table. This is untested, waters, and there's surely no playbook. And I'm going to, I will absolutely act and do whatever I have to do to protect our people. But But we've just got to understand that well, I'll say it in my closing comments, but that's all I've got, Mark. Right now, no, there's nothing that's been put on the table in regard to using, your vaccination card or whatever like that as a requirement to come into a restaurant or a store or whatever. But Mark, really and truly, at the end of the day, I just wish that we could get more cooperation out of the Biden administration and we could get more communication and moving forward from the federal government. But nevertheless, we're going to have to keep everything on the table and consider everything if this thing continues to get worse.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi, I've got, I guess, 1.5 questions. The half question is the follow-up to what I asked Monday about what local entity might have the power to do a countywide mask mandate. That was asked in the context of masking in private schools versus public schools, and I've gotten more questions about that. There's not a lot of local clarity in who can do what. And then the whole question is, I wanted to get a better grasp on the Delta numbers. There's 554 Delta cases at the moment, 11,000 some active cases, and there were over 1,000 new cases the past couple days. And I know you do some sampling, and your sampling shows that about 99% of those tests are Delta. So how do you do projections to the larger numbers from that? Can you use that sampling to guess how many of the 11,000 active cases, 1,000 some new cases are Delta? Thanks.
David, let me do the first half, because this is the half that's probably the most vivid on social media or wherever it may be. But from the standpoint of the mask and a mandate within the counties and so on like this, David, if we keep going the way we're going, it's almost inevitable, But we're on top of it. We're watching every single movement, and like I said, I am not here. I am not here to please the Republicans. I'm not here to please the Democrats. I'm not here to please the independents. I'm not, David. I'm just not. And I'm going to do what is very best for all West Virginians. That's what I've done from day one, and that's what I'm going to continue to do. Now, I have solid conservative feelings about me in every way, and I'm trying to look at it in every way. But at the same time, my conservative values and everything are first and foremost driving me to make the right decisions for you in regard to countywide mask mandates or whatever it may be. But we're getting closer and closer every day, and so I'll defer on the next thing. There are way more states. I think there's only 10 or so states that have mandated masks and everything, but I'm not going to wait for all kinds of people to be lined up in body bags to move because of some form of political pressure or whatever it may be. I'm going to try to continue to make the right decisions that I can make in my heart for all West Virginians. But the second half of your question, I'm going to probably defer to Dr. Marsh. Maybe you could answer that better than I.
Thank you, Governor, and thank you, David. So, David, we know with, I think, incredible certainty, probability, that these are all really coming from the Delta variant. As we've done our sampling, as we look at sampling around the country, this variant is so rapidly spreading that it basically eradicates its competitors over a really short period of time. And as we've said, it has a very steep upslope, and then it peaks and it starts coming down. And in some of the southern states, we're starting to see it come down. But the difference is from what we saw in some other countries, even in some of the places is coming down, we're seeing the death rates rise. So we know the impact of this variant is continuing to be felt, and we are seeing our slope going more rapidly up. So the reason why we're making such an impassioned call for people, to come to arms is that we believe deeply that now is the time to try to protect people, because that slope, if it continues to go up at the rate it is going to start to impact very soon our ability to do the best job of caring for all the people involved. And that we know that this thing, once it starts to move, it's very hard to control. And so right now, we're really looking to try to get as many people to be firewalls so that we can stop the spread of this increasingly large fire in West Virginia, so that it doesn't get out of control, doesn't overwhelm our hospitals, and that people don't unnecessarily get sick or die when we have the best treatment, which are vaccines. So I think that we can feel absolutely comfortable. This is what happens when the Delta variant really takes hold in your state and in your communities. And that's what we've been predicting and talking about for a while. We're now starting to see the more power of this variant as it spreads.
All right, thank you, David. Next to June Leffler with West Virginia Public Broadcasting.
Hello, good afternoon, panel. So two questions I have. As far as our trajectory, Dr. Marsh spoke to the fact that in some southern states that were hit harder and earlier than us, they are seeing their peak. I'm wondering if you all have any projections as to when we will see our peak and what that would look like. And then also onto the hospital staffing issue that Hoyer discussed. He mentioned that other states are, able to poach some of our staff. I was wondering if you could just speak to how much the state relies on maybe traveling practitioners, because I would imagine it would be maybe harder to poach, nurses that have families here, that live here. So if you could just speak to that, I would appreciate it. Thank you.
Maybe Dr. Amjad, you could take some of this, or back to you, Clay, but this is for y'all.
Ryan, you want to start?
Sure. June, to answer your question about projections, we seem to be about 3 to 4 weeks behind other states, at least when we look at some of the previous data from the last couple of months. So if we were to predict any type of surges or what we're going to see in hospitalizations, I would say 3 to 4 weeks. But with Delta, as Clay has mentioned, it's kind of accelerating a little faster. And even our own cases here in the last 2 to 3 weeks, we've seen a 4 to 6-fold jump in cases. So if I were to have to predict something, it takes 3 to 4 weeks the last couple months, but we're seeing cases jump 5 to 6 times, we might expect to see something the next 2 to 3 weeks. I would just shorten it because it's the Delta variant. But I'll also let Clay comment on that, what he would think. But I think everything's a little shorter than what we would predict.
Thanks, Ryan and June. Just to add a couple of things. So as we look at the southern states where the number of cases seems to be receding a little bit, I think the important observation is, unlike what we saw in the United Kingdom, that we're still seeing the severity of the illness be perpetuated. As I said, Arkansas and Alabama are out of ICU beds. State of Florida is very low on ICU beds. And we see the death rates going up in those states as well. So it says that the severity that we're seeing in our population is different than the UK saw in their population. And part of it's because we have such a larger number of unvaccinated people and maybe sicker people, but also part of it very well might be, some other issues with the foundational health of our citizens. So as we look at our own hospital standpoint, some hospitals, but not all, have started to open up more capacity by reducing some of the elective surgeries and other procedures, which is how the hospitals dealt with it during the first part of the pandemic. And although the hospitals have had some use of agency or traveling nurses, in general, the hope has been to continue to make sure that we are rewarding our own people in a way that they're not, liable to go off and work for those companies. and also that we're able to take care of them, because right now, the healthcare workers and the frontline healthcare workers, certainly including nurses and others, are really heroes. And we don't ever want to forget that, because ultimately the well-being and the health and the survival and thrival of our population is going to be based on our level of vaccination and how much care we're taking, protecting ourselves and others with mitigation measures on top of vaccines being the most important, but also how well we can maintain our hospitals' functions. Because we know, as we've said before, that when hospitals start to really have problems, then not only is it the COVID patients and the folks that have complications from that have problems, but also we have problems taking care of people with heart attacks and strokes and other medical issues as well. So this is a super important issue, and that's why we're asking all West Virginians to help us by running to the fire, getting vaccinated, and taking care of yourself. Be careful with more mitigation with masks and other things, because we need to stop the rapid spread of this that is starting to really take off in West Virginia.
All right, thank you. Governor Justice, I'll turn it back to you.
Okay, I've made myself several notes today. I hope that we've got lots and lots and lots of viewers, and I know we got our media still on and everything, and I just want to go through just 2 or 3 points here with you. You know, I appreciate your faith and your trust that you've placed in me, and I hope you know without any doubt whatsoever that I'm going to continue to do everything I possibly can to protect you and to look out for every single one of you that in all across this great state. I think it's really important that we bring back up a statement by General Hoyer, a guy that served this state unbelievably, and a guy that loves you and is a tough guy, and he's just absolutely laying it right on the line to you. He said, unvaccinated people are filling up our hospitals. Now, unvaccinated people are filling up the hospitals. It could very well be, in his mind, that we could potentially double a number that was the highest hospitalizations that we had, and I think he said 849. We're at 64% of that number right now. And he's worried that number, that surge number, all-time surge number high, could even double. What are we going to do if that happens? Ask yourself just this. What if you had a child that was severely injured or sick? What if you had your dad that had a heart attack or a stroke and the hospitals were completely filled? How would you feel? How would you feel about people that made a decision to not get vaccinated? You wouldn't feel very good. There's no point in dancing around all through the raindrops about it. You'd be really, really upset if you couldn't get hospital care because people decided to not get vaccinated. And the hospitals were filled, in the general's words, the hospitals were filled with unvaccinated people. It wouldn't be good. It just wouldn't be good. Now, I would ask all those that are unvaccinated to just ask yourself one question. You know, I was, and I don't hardly ever leave this state because I love to hunt and fish and all the great stuff in this state, and I just don't go places. So with all that, at one time, way before I became governor, you know, I had a little back issue going on and everything, and I went to Colorado to go elk hunting with at that time, the president and CEO of Consol Energy, Brett Harvey. And Brett Harvey is a wonderful man, absolutely good friend and a wonderful man. And I could never say anything but great accolades towards a great man that served a great company in Consol Energy in a great, great way and everything. And what an incredible sportsman he is. A guy that loves to laugh and everything, really, really good guy. Okay, so I go to Colorado to go elk hunting with Brett. I've got this back thing going on, and all of a sudden it gets to a level that is bad, really bad. And Brett looks right at me and he said, I'm going to tell you right now, you probably need to go home. And then he looked right at me and said just this, because I said, Brett, no, I'm not going home. And he looked right at me and he said, you should do what your dad would tell you to do. Now I'm telling everybody staring at this vaccination stuff and everything, and maybe your dad is living, and maybe your dad's passed away as my dad had at the time. And he looked right at me and said, you better do what your dad would tell you to do. Well, I'm going to depend on a lot of dads, a lot of dads out there that are going to tell their kids, no matter if that dad is 90 years old, or maybe that dad has passed away, and he's telling them through voices that he can tell them. Ask your dad what your dad would tell you to do about this vaccine. I can't imagine that the dads would tell their kids not to take the vaccine. It's too important. It's too important to all of us. It's too important that you don't fill up the hospitals and restrict our care. You know, it's too important to all of us. You got to get vaccinated. Now, the bottom line to the whole thing is just one thing and one thing alone. From Jim Justice's standpoint, and I want everybody to hear this loud and clear, Jim Justice is going to first and foremost listen to the experts, because the experts work this every day, and I have incredible faith in the experts. And that's Dr. Marsh, Dr. Amjad, Bill Crouch, General Hoyer, on and on and on. I'm going to first and foremost listen to their advice, and then we're going to continue to make decisions. I am so hopeful that what we are trying to do is skate this razor's edge and not lay additional mandates on our people. If we can get through the surge area and start declining without laying some level of mandate on our people, it would absolutely be the very best of the best. That's what I'm trying to do. I'm trying to watch it with all in me, and I'm trying to get you there. So with all that being said, I'm going to leave you with just this. Do what your dad would tell you to do in regard to the mandates. It is so important to listen to General Hoyer saying unvaccinated folks are going to end up filling up our hospitals and restricting care that those hospitals are able to give to patients that are coming for every reason, from heart attack or stroke or whatever it may be. Unfortunately, if you don't choose to run to the fire and get vaccinated right now, I'm going to just have to sit here and read death after death. Some of you that are listening to me right now could very well end up me reading that death after death and dying a miserable death, just like the coach said to us today. So, Paul, thanks for bringing the coach on. Thanks to the coach for all the great work he does with the kids and everything he does all the time. But thanks for his courage to stay in a really tough time. I know he's having a really tough time about his mom, and we're going to say many prayers for her and him, but thanks for a great testimonial from that coach. So that's all I got today. We really need to get you vaccinated quick. We don't need you absolutely to trickle in, at 2,000 or 3,000 a day. We need you to come by the tens of thousands and come right now. Thank you so much.
COVID-19 is still here, and the new Delta variant is stronger and more contagious than ever, and it's causing cases to rise across the country. If you're unvaccinated, you're at the greatest risk. Vaccination is the best protection from COVID. The vaccines are proven to lower the risk of infection and prevent serious illness and death. It's why doctors and pediatricians recommend that West Virginians 12 and older get one. You can protect yourself from COVID by getting vaccinated.